Okay, we're connected. You may begin.
All right, good evening. I'm Richard Nobles, and I serve as chair of the Licensed Psychology Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. Today is Tuesday, the 14th of April, 2026, and I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Linda Heitzman Powell,
Present.
David Stevens,
Here.
Jennifer Fontaine.
Here.
Daniel Gerlach may not be with us tonight. Matthew Golker is not here. Jessica Hamilton.
I'm here.
Edward Hunter isn't here. Tiffany Johnson.
Here.
Sarah Kirk will not be with us this evening. Christopher Leonard.
Here.
Jay Middleton.
Here.
And Robert Twillman.
Here.
I note the following staff person is also present, and that's David Fye.
Here.
And next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Richard. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or the KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no time for public comment as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On February 16th, 2026, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel, allowing members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may contact the board office by sending an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. The conference call line is active. I did check it before we got started. There's no one currently on the line, but if I hear someone connect and introduce themselves, I will let you know.
Thank you, David. Much appreciated. And the meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda, and that's to approve the agenda.
And Richard, just to let you know too, during the informational items, I believe Ned Hunter was able to log in, so he is present as well.
Yes, thank you very much. Good evening, Ned. So I'll take a motion to approve the agenda from someone.
Motion to approve the agenda.
I'll second.
So we have a motion and a second. Is there any discussion on the motion? Seeing none, all those in favor of approving the agenda, please signify by saying aye.
Aye.
All those opposed, same sign. The motion passes. So I'll move us on to the next item on the agenda, and that's the review and approval of the minutes from our last advisory meeting in February. Everyone has been sent those meetings for review, and I'll take a motion to approve the minutes from the February Licensed Psychology Advisory Committee meeting.
Move to approve the minutes.
Jennifer moves. Do I have a second?
A second.
Chris seconds. Any discussion or any need to edit?
I didn't see any.
Seeing none, all those in favor of approving the minutes from last meeting, please do signify by saying aye.
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 Those opposed, same sign. The motion passes. So I will now turn it over to Dave for his executive director's report.
All right, thank you, Richard. We will start with a few updates on BSRB operations and then touch on some legislative updates and then make sure to cover some of the items from the most recent board meeting. Starting with operations updates, the Assistant Director and Licensing Manager, Leslie Allen, and I have been very active. We do presentations to students every spring and usually a few in the fall as well. We have been meeting with lots of groups of students. The presentation that we tend to do focuses on about three main areas. One, we try to help educate students in terms of the role of the BSRB as a state licensing board, and we help them understand sort of our jurisdiction and our resources that we can provide to them along their path to becoming licensed professionals. We also provide information specifically on how to apply for licensure and then what to expect as they go through that process towards working to become a licensed professional. And then we take a proactive approach to talking about the subject of discipline and unprofessional conduct and responsibilities as a professional. So we spend time going over the difference between the ethics of an association versus unprofessional conduct rules in the law. We talk a little bit about the board's process we go through with our complaint review committee. If we get a complaint from a member of the public or a licensee, or if it's initiated by the board itself, and then the process we walk through as we investigate that and what to expect. We also talk about some of the frequent violations we see just to help those individuals be mindful. We hope that we will never have any of those individuals get a complaint against them, but we also want to prepare them that if they do have a complaint, it is very important they respond to that in a professional way. So this is one of the most important things that we do in terms of reaching out to people before they get licensed so they have the right mindset and get the best start to their professional career. So we've been, Rick had said, reaching out to lots of groups of students. We will do probably a couple more before the end of the school year, and then we'll prepare for next fall. In terms of other things we're working on here behind the scenes, we are working on moving forward with a background check requirement for licensees. We have done the trainings with the Kansas Bureau of Investigation as far as our staff here. We are planning to launch that as soon as we get approval to be able to have our privilege fee for the licensed psychologist or the professional counseling multi-state compact. That is something that we need to have put in place, and it's been going through the process with the Department of Administration and the Attorney General's office. But once they approve for us to put that out for public comment and then it becomes effective, we will be able to launch with the Professional Counseling Multi-State Compact. And as part of that requirement for the compact, individuals would need to have a background check. So when we roll out this new process, we will do it first for that group of people. So they will be able to opt in for the background check requirement. And then once we make sure that we have a good system in place here, then we'll be able to look to the future, probably later this year, in terms of making it a requirement for all new applicants. We do not have the plan to go back and have licensees who are already licensed have to go back and do a background check. But so this will be a requirement for new applicants, and then those that need a background check as a condition of licensure for the right to practice under one of these multi-state compacts. So that is the plan moving forward. We've done about as much as we can here internally and working with KBI. What we are waiting on now is just the regulation process to move forward, and we're hopeful that we will have good news on that in the next few weeks. In terms of some other items we're working on, like I mentioned, the regulation system, the state is launching a new initiative as that goes into place. The state is contracting with a group called ESPR to move our regulatory process forward. It used to be, for many years, a paper-based system where people marked up edits, submitted those for changes, they were stamped, and then sent back and forth. This will have a more up-to-date technology approach. So the system will be something where we can submit things electronically, they can be returned. It should cut down the time frame as entities bounce things back and forth. So we're excited about that, but also we have gone through a couple of trainings with ESPR to make sure we're prepared for that as well. Additionally, I do want to make you aware the survey reports for licensees that had to do with the surveys that all the license groups took last year. 5 of the 7 reports for licensees have been posted on the board's website. And so we've been working with those draft reports for the surveys. And the draft reports for the surveys have been what a lot of the committees have been reviewing and having discussions on. We have published under resources, publications on the board's website, a copy of the survey report for every profession except for social work and also the addiction counselors. Those were the 2 largest reports, and also the social workers, they were surveyed towards the later part of the year. So we didn't want to hold back the remaining reports. So we should have all 7 on their website here in the near future, at which point we will send a message out to all the licensees to thank them for responding to the survey last year and providing feedback. But I did want you to know that the survey for your profession is posted, so you are welcome to go and take a look at the final survey report. In terms of some updates from legislative committees, the legislature has officially wrapped up the 2026 legislative session. Every spring, the legislature meets for about 90 days. As part of that process, the committees meet and have bill hearings, work through different parts of the legislation, and then ultimately they take a break for about 2 weeks to allow the governor to review legislation that has been passed. The governor has the option to either sign things into law, to veto different bills, or to allow things to go into law without her signature. And she does have the authority to do line item vetoes on appropriations bills, but that's the only bill that doesn't have a strict either veto or, not veto it. And so the governor did veto several different provisions in the appropriations bill that was passed. And then the legislature came back at the end of last week on Thursday and Friday and worked well into the night on Friday, I believe at least until about 2 a.m. in the morning, maybe closer to 3 a.m. But they did complete the session. They did adjourn. And so unless there's a special session this fall, which there's not scheduled to be, but you never know, then they should be done for this year. In terms of bills that were passed, we have a pretty good sense of all the different items that were passed by the legislature. However, during the last stages of the year, a lot of the conference committees that meet have the authority to take pieces of bills and combine them into a conference committee report with other bills. And then the legislature would be able to vote on those conference committee reports. So there could be, a combined number of bills, and it's harder to track those items. But in general, a lot of the bills we were tracking did not advance this year during the legislative session. A few that did advance this year, one of the items relevant to the committees for the BSRB, there was a bill that would have prohibited certain requirements for academic programs and universities that taught subjects on the topic of DEI, and it would have prohibited some of the programs from having that as essentially a requirement for obtaining a certain degree. You could still teach classes in that area, but that is something that the legislature was moving forward with restricting. That bill did not move forward this session. It had a hearing, but some of the language for that bill was put into the appropriations bill and was enacted. And then that did go into place. And so that language did move forward. I believe it will focus on fiscal year 27, so it doesn't go into place just quite yet, but that is something relevant to some of the committees under the BSRB. There was also some legislation this year that looked at artificial intelligence and the regulation of artificial intelligence. There was one that really focused on things like prohibiting chatbots from doing certain things, but neither one of those bills moved forward. I believe one of them had a hearing, but neither one was passed this year. So we'll continue to monitor bills like that in the future. There were some bills that were debated that dealt with regulatory boards, but one of those bills that would have prohibited licensing agencies from making changes to the requirements for licensure absent legislative action. That specifically excluded the BSRB and about 5 other health agencies. So that one did not affect the BSRB, but we were monitoring that. So the big takeaway is the legislative session is done. If you do want more information on any of the bills that passed, the legislature's website is a good resource. You are able to pull up past versions of bills. You're also able to see some information as far as amendments with floor action and the dates. So I would encourage you to take a look at that website. In terms of some other news, I will just make you aware of. We'll talk about this a little bit later, but the remainder of this week, I will be out of the office attending the mid-year meeting for the Association of State and Provincial Psychology Boards, ASPPB. I'll be attending that meeting with David Stevens and also David Anderson, representing the state of Kansas at that conference. Unfortunately, through a scheduling issue, they scheduled the annual or the mid-year meeting for the Social Work Association, ASWB, as well this week. So my assistant director, Leslie Allen, will be attending that meeting with Cynthia Schindel, who's one of the social work members of the board. So we'll be out there representing the state, and we have a couple of items we will talk to you about during the meetings today and collecting your feedback on, but that will be some of the upcoming events. And then last, moving to items from the most recent board meeting, the board met on March 9th. The board continues to walk through the unprofessional conduct grid with different recommended changes from the advisory committees. The board also considered several recommended changes to regulations that had been forwarded by the addiction counseling, professional counseling, and social work advisory committees. The board also received recommendations on proposed changes for the regulation of artificial intelligence from the Behavior Analyst Advisory Committee, Master's Level Psychology Advisory Committee, and Professional Counseling Advisory Committee. Those recommendations were fairly similar and focused on three main areas. One, if someone is using artificial intelligence when they're providing services to clients, they should inform the clients they are using artificial intelligence for that purpose. Two, if they're using artificial intelligence in practice, they should make an extra effort to ensure that they are using appropriate technology to ensure confidentiality of information is preserved. And then third, I believe at least two of the committees made a recommendation that providers should allow the ability for a client to opt out if they do not want artificial intelligence used in the provision of the services they are receiving. The client should be able to opt out of that. And so those were forwarded to the board. The board did not take specific action on those recommendations, but about half the committees have not yet made an official recommendation to the board on that topic. So the board may be waiting to see what the other committees would provide. The board is also continuing to have conversations on a strategic plan for the agency, a multi-year plan moving forward. The board also discussed an item that had been referred to it by a member of the community concerning whether the board was interested in pursuing a pathway for licensure for artificial intelligence mental health agents. So I think this is something that the board maybe had envisioned might come at some point in the future, but that request was made now, and it was not a request to license a mental health agent. It was more of a conversation if the board was open to considering that. So we did have a conversation with the board. Under our existing licensure laws, those are built from the perspective that a licensed professional is a person. And so there's also certain restrictions about using certain technology when you're doing things like taking the licensing examinations. And so if there was a path for this option, it would require significant changes to the licensing laws for any of the professions. So it is not something the board expressed an interest in moving forward on, but we are going to continue to monitor that conversation to see if there are changes in other areas or other professions consider that topic. The last item I will leave you on for the next board meeting of the BSRB is going to be on May 11th. There will be a special guest at that board meeting. Marianne Bernetti Atwell is the CEO of ASPPB, and she has informed the board that she would like to attend and meet board members, and so she will be a special guest here at the board office. Dr. Bernetti Atwell has made it a priority over the last few years to try to reach out to all states and provinces that are regulated in the profession of psychology. And she would like to go and meet with about 5 or 6 per year as her schedule allows. And so she's been doing this for about 3 years. And I had talked to her at the end of last year, and she expressed a desire to come out and meet individuals in Kansas. So she will be at the next meeting. So feel free to join us if you are interested in meeting Dr. Bernetti Atwell. But otherwise, my report, that concludes my report. I'm happy to answer any questions from any individuals on the topics I discussed in terms of our operations, legislative updates, board news, or any other topic.
Thank you, Dave, for the report. Does anybody have any questions for the executive director about his report?
Can I ask a
just-
clarifying? Oh,
Go ahead.
just a clarifying question about the AI agents. Are we talking about like companies or like specifically licensing a bot, like bots within a company?
As I understood it, the proposal that this individual was interested in pursuing was for an actual artificial intelligence, for lack of a better term, a bot. It would be, was there a pathway for a bot to become a licensed professional?
And my question was, are we allowed to know who submitted that question or request?
Well, when the board discussed it, it was kind of presented as just a general topic, just to kind of remove any kind of bias if anyone is familiar with the name of the individual. I don't recall the name of the individual, but I'd be happy to look into it. That information can be requested, so we'd be happy to provide that. I just don't recall the name of the person. But usually, if a question like that comes forward, we kind of try to take a high level approach and say, if this request had been made by anyone, would the board be interested in considering this as a general topic area versus this is a specific request by this one person? But I'd be happy to get you information if you're curious about that. So.
It was mostly curiosity. I don't need to know the name of the person.
Okay.
Two things. One, I want to acknowledge the presence of Matthew Gelker, who has come to the meeting. Good evening, Matt. Secondly, Dave, and going back a little bit about the when you were talking about the legislative updates and the board's issue, did the nursing board bill pass though about because that was along the same topic line, right?
The
Same
board,
subject or same issue.
well, the Board of Nursing did have some significant changes that the legislature had proposed this year, and so that bill did pass. It was modified several different times as it worked through different committees, but that ultimately was passed by the legislature. And so I have not had the opportunity to really do a deep dive into all the different things that were changed in that bill, but I know that it did have significant changes to the Board of Nursing, and that bill did pass.
Okay. Anyone else have any questions for Dave? All right, seeing none, thank you very much for your report, and I'll move us on to the next item on the agenda, and that's updates on ASPPB. Dave.
All right, thank you, Richard. As I mentioned, ASPPB has a mid-year meeting every year. They also have an annual meeting, but for the mid-year meeting, it gives us an opportunity to speak with staff and discuss any items that the board of ASPPB has proposed or even voted on. And there's a couple of notable ones, so I wanted to kind of make you aware of some of those. First, the agenda talks about a model disciplinary guidelines from the Committee on Disciplinary Issues. So this is a committee for ASPPB, and they had reached out to member states and jurisdictions, basically saying that they are looking at putting together essentially a list of disciplinary processes or they're looking at that. Is there interest in having model guidelines for disciplinary items? And so, some states potentially would adopt a ethics code from an association. Others would put into place their own unprofessional conduct standards, for example. And part of the reason there are differences is because, sometimes in an ethics code, there is a gold standard, there is sort of a best practice type thing. And then there is the area where if you fell below this level, it would be a violation. And so professional conduct really focuses on just that bottom level, that if there was a violation or if you did these things, this would lead to a disciplinary remedy. And so, unfortunately, what that has meant is that a lot of states have different disciplinary items, and they are trying to work on if this would be something that states would find beneficial to have model guidelines and different items that should be considered when going through that process. And so I wanted to kind of make you aware they were seeking feedback on that. I'm happy to kind of collect more information from the mid-year meeting and bring it back to see if other states have an interest in that. I think we are always looking to see, can we update our items? Can we, add more things that would help things be beneficial? We have a number of things on our website in terms of FAQs. We have an investigation policy that's posted. The professional conduct, we're going through the process right now of each of the advisory committees making recommendations, the board going through trying to standardize language. So I know this is a big area of focus. If you do have thoughts on this topic, just let me know. I'm happy to carry those forward. Or, if you don't have thoughts today, I'd be happy to collect information and bring it back to you. But I wanted to make you aware of that as an item. And maybe I'll just go through the different items and then see if there's questions on any of the three. The second item on the agenda as an update for ASPPB is the integrated EPPP, updated timeframe and price increase beginning in 2028. So you are familiar with the conversation that took place the last couple of years concerning the EPPP2. Originally, ASPPB was putting forward a plan to make that second test a requirement for all states as of a certain date. There was a lot of pushback by states in terms of making their a second test be a requirement for licensure. Kansas joined with Texas and a number of other states opposing a requirement of a second test, and thankfully we were able to persuade the ASPPB board not to have that as a second test. But as an alternative, what they decided to do was put together a task force that looked at taking elements from a knowledge-based assessment and a skills-based assessment and try to make it into one new version of the EPPP. And so what they have said is that they are planning to release the new version of the EPPP, I believe, in late 2027. They are also working on figuring out the fees for the new examination. The new information that we just recently received was that the ASPPB board has voted to increase the price of the EPPP from the current price of $600 to $650, effective April 1st, 2028. And there was also language in that announcement that said, with a biannual increase informed by the Consumer Price Index beginning April 1st of 2030. And so I did a little bit of research. It looks like the fee for the EPPP has not increased, I believe, in the last 13 years, but there was a significant increase at that time. I think it went from 450 to 600. But there has not been an increase, I believe, in close to the last 15 years. They are proposing, or not proposing, they have voted on this, but there can still be pushback by membership, and we can definitely go and ask questions and express whatever you would like me to express at the mid-year meeting concerning this topic. I am curious if you have thoughts on the increase from 600 to 650 beginning on April 1st of 2028. I'm also curious if you have thoughts on the language about the biannual increase informed by the Consumer Price Index beginning April 1st, 2030. And the way I interpret that language is basically they would have an increase in 2028 from 600 to 650, but then every 2 years, starting in 2030, essentially they would look at inflation and the consumer price index to determine should there be another increase that would just be based on inflationary factors. So I am curious if you have thoughts on that. And then the last item for ASPPB updates just the mid-year meeting. Like I said, I'll be attending that over the next few days and bringing information back. But I want to turn it over to you. I do try to collect all of your thoughts and feedback as members of the psychology profession. And so if you could share with me any thoughts you have on those price-related news items or on the idea of having a model disciplinary guidelines, I'd be really curious to hear your thoughts on those topics.
Any thoughts from members?
I have a question, David. Do we know what their annual operating budget is and what they pay for?
I do not know what their annual operating budget is, but I could collect information or request that information. In terms of, yeah.
Yeah, it just seems to me that in terms of being, they're not a commercial organization in terms of like product sales. The product that they do sell, which is the EPPP, has shelf life. And so I'm wondering why they're proposing an increase every 2 years. I just think of our budget, and of course, we're all volunteer members here, but you have staff, right? And we're looking at decreasing the cost of licensing in the state versus continuing to increase it. I'm just curious about the motivation behind the change.
Taking some notes so I can make sure to bring back information on those items. I can tell you some of the other professions that we have professionals in, their bylaws basically restrict this kind of a topic to the members, the body. If they want to increase the cost of the licensing examination, that's a decision by the body. When this news came out, I did look at the bylaws for ASPPB, and this is something under the bylaws that is under the authority of the board of that association. So this is not going above what power or their delegated authority. But it is interesting because it is different. Some of the associations say this is a decision by the body. This one is specifically under the decision of the board members, but that does not mean that the member jurisdictions cannot go and ask these questions, collect information, or express concerns or opposition. So
I would say part of the challenge that I've seen, and it's not like I've been around a long time, but the power that's invested in this particular board allows them to make unilateral decisions that affect member organizations. And this seems to me like one of those decisions that could potentially impact upcoming professionals' ability to be able to afford to take the test. And then I would say, hence the Texas visitors that we had last month that are talking about going out and trying to develop a different examination. I don't know, maybe I'm a little jaded, but I feel a little suspect at this point that it's more self-serving than it is necessary to be able to maintain the test integrity. But
I vote. So I meet with Dave before this meeting, usually a week before, and I vocalized a similar concern to Linda when it comes to the licensure of up and coming professionals. It's already an expensive examination, and while a $50 increase, I mean, it can be argued one way or another that that would be appropriate. I am concerned, I think, and Linda, please tell me if I am not if I'm not conceptualizing what you said correctly, I'm concerned about this being tied to inflation and how that can have a significant effect on the ability for a psychologist or a postdoc to pay for the examination. That
Yeah.
is concerning for me.
I mean, it's not like there's anything we can do about it because did you say in their bylaws? Their bylaws give them the authority to make this decision? Yeah.
Yes, so this is under the authority of the elected board for that association. They do have
Yeah.
the decision on how much the exam should be. It's under the authority of the elected board for ASPPB. But that does not mean that we can't ask questions, collect information, or express that we are concerned or opposed to this kind of a thing. And potentially that can lead to changes in terms of, if I will start with collecting information about the need for this. From a technical standpoint, what Richard, you said, and Linda, from a board perspective here, we have really tried to go out of our way to make sure that our license fees are lower than, as many other states and jurisdictions as we can, and looking to see if we can continue to lower those. But, I do know that there are places that have had inflationary increases. Um, so it's a tough thing, but we did not receive any language in that announcement as far as the reason for the price increase. So I'm happy to collect information about their current finances and different things and bring it back for the committee.
And you can also ask them, David, that if we're in a recession, if they plan to reduce the cost and by how much. Okay.
I think a question I was having, the schedule, is that I never said that word right, but is it ongoing forever, or could there
In
be a schedule
perpetuity?
of like,
So
yeah, in perpetuity, could it be like a 5 year and then it has to be revised again or reviewed again? I think it's just because sooner or later it'll be $1,000 if it's just on a schedule.
Yeah.
Yeah, the tricky thing is they use the term biennial, which I believe usually refers to twice a year. But I think in this context, they're meaning every 2 years they want to have it be reevaluated. But from a technical perspective, I have concerns with that because it does say the board has the authority to determine the price. So if you were to pass this, you're essentially tying the hands of future boards, basically putting in an automatic increase every 2 years without the board at that, the new combination of people making that decision. So it's there is one thing as far as the $50 increase in 2028. There's the other one that has the automatic potential increase every 2 years. And I have not seen that language in any other bylaws. So that is unusual language to say the least, but I'm happy to go and express concerns and collect information. And if other boards feel very strongly, this could be something that we try to address at the annual meeting. So
I'd be curious if they've given any thought or study about how this might impact low SES folks, how it might disproportionately impact certain populations, and just I'd be curious to know if they've done any of that work besides for just talking about the broad picture increase, but how that can affect specific populations.
That's a
Taking the
great
test.
question, Jay. Good question. I would like to know the answer to that as well, David.
I added that to my list, so I will ask them that question.
Any other questions, comments, concerns for Dave on this topic? Seeing none, thank you very much, Dave, for keeping us apprised of the ongoings with ASPPB in these matters. It's really important, and our members clearly have expressed concerns about about the potential price increases and how that can affect a whole swath of prospective psychologists. I'll move us on to the next item of the agenda, and that's an update on SIPAC. I don't have any updates on the the body as a whole. Next week, I serve on the finance committee, and we will meet next week to make some determinations about investments that SIPAC will make to ensure its long-term financial future. And I can report back have once those have been made and reported to the executive board of SIPAC, and once um, the proposition has passed. So I will keep you posted on that. And the mid-year meeting is not until July, and I will also update you on anything that might occur with respect to the mid-year meeting for SIPAC.
Thanks, Richard. I have one
Yes.
related update for SIPAC. So some of you may have seen an email from the BSRB either this morning or maybe yesterday. So basically, when the SIPAC legislation was going through the original steps to become law, one of the things that was discussed is that part of the financing for this compact is the SIPAC Commission looks back to see who is practicing under the compact and then charges those states $10 per psychologist who identifies certain states with a home state. So, for example, any psychologist who's practicing under SIPAC who lists Kansas as their home state, they will charge the state of Kansas $10 per psychologist every year as sort of a look back mechanism. And who pays that $10 on behalf of this bill from SIPAC? It goes to the BSRB. And so we pay that on behalf of the state. And so when this bill was going through the process, one of the advocates for the legislation, representatives from the Kansas Psychological Association, the KPA, requested the legislature add some language that would authorize the BSRB to be able to charge a $25 fee to basically cover the cost of that assessment, more or less. And so the language was added by the legislature. It is called a home state privilege fee for anyone who is practicing under SIPAC authority, who is licensed by the BSRB and their home state is Kansas. And so the board has the authority to charge that when someone becomes licensed or when they renew their license. The board decided to only do that when they renew their license. But this means every 2 years for anyone who's practicing under SIPAC authority. When they renew their license, they will also need to pay this $25 fee to the state of Kansas. And so it affects about 130 people that are practicing under SIPAC authority with a Kansas home state license. We did our best we had some internal discussions how we could best collect this fee. We did not want to include it as something that a lot of people would accidentally pay for when they didn't need to pay. But we wanted to make it clear that this was something that was a requirement under the law. So we have put together a list of all the individuals that are authorized under SIPAC authority right now. We have sent the information out to people and put a note on the BSRB website explaining the history and why this fee is being collected. And then in July, if there are individuals who renewed their license but had not paid this fee, we will circle back around and reach out to them to make sure that they've also paid this fee as a combination of their renewal of licensure. But it is something that we would prefer to have go away. But as long as we have the yearly assessment by SIPAC, I think we need to do this to maintain our operations. And so SIPAC, as one of their funding mechanisms, has done this assessment. We've asked about it over the years. Like I said, if SIPAC were to have the assessment go away, I would go to the board and say, I believe we should make this fee zero instead, but we're not there yet. And so I just wanted to kind of give you an update in case you received that email and had seen the news, but hopefully this clarifies it. We've received a couple of questions in the office, but in the email we sent out, and we included some of the history and the reason why this is in place, and that has answered most of the questions that people have had. But happy to answer any questions any of you have about that here today too.
Thank you for that, Dave. I really appreciate it. And yes, that came through today on my end. So any questions for Dave regarding SciPact? Seeing none, I'll move us on to old business. And the first item on under old business is a continued discussion on the regulation of artificial intelligence. And Dave, I'll have you frame the discussion,
Thank you,
please.
Richard. So this has been a topic that has been on the agenda for several meetings now, and this was something the board had referred to all the different advisory committees to basically have a good discussion on and collect information. They wanted each of the advisory committees to have the opportunity to educate yourselves in this area and then determine if you thought it would be appropriate to make recommendations back to the board. So as I said earlier in my executive director report, 3 of the committees have made official recommendations to the board. You're not required to do that, but if you want to do that, you could wrap up this item. But to assist you in this work, we've tried to bring you information as far as what other states are doing. So there were a few different states that were used as examples with some of the laws they've passed. We've talked about some of the speakers other committees have brought in. We've talked about some of the continuing education opportunities as you look at artificial intelligence in this field. So we've done our best to get information to you. I guess the question for you today is, do you want to make a recommendation to the board? And if you do, I'd be happy to help you with what other committees have recommended. I kind of summarized that earlier, but if you would like a reminder about that, I'd be happy to kind of cover that ground again, and you could have a conversation if you would like to go in that same direction, or if you would like to make a different recommendation to the board, or no recommendation, that's okay too.
Any thoughts from members?
Dave, I noticed that one thing that Missouri did was to pass a law saying that AI cannot present itself as a therapist. And I'm wondering to what extent the term therapist is regulated in Kansas. And if it's not, does that speak to the need for us to pursue some legislation along those lines as well?
So, I don't believe that therapist is a protected term under the law, because I think there are some different groups that would have therapy and use the term therapist. So it's kind of a more broad term than what might be under title protection for some of the professions. When it comes to regulating artificial intelligence specifically, that may be something bigger than the BSRB. So the approach the other committees have taken is basically, instead of regulating AI itself, they basically look to say, okay, what's the jurisdiction of the licensing agency? Well, that's really the practitioners that are practicing in this area. So instead of going directly to say, AI, you can't do this or you can do this, we look at the people that we have jurisdiction over, and then the recommendations would be more or less adjustments to the unprofessional conduct standards, to basically say, if you're using AI, here are the responsibilities. You need to be having appropriate actions in terms of use of technology as it relates to confidentiality, making sure that you're not putting information out there that's going places that it shouldn't. Making sure that if you use AI, you have informed consent, that the client knows you're using it for client-related services, and then perhaps give people the ability to opt out. But I think if it came to trying to put forward legislation to prohibit AI from doing something or control it, that might be a little bit bigger than our ability to do things. Although the good thing is the state is moving, it appears, that direction, at least with some of the bills that were introduced this year. But that might need to be introduced by sort of an entity that's a little bit bigger than us. So.
What do you mean, an entity that is bigger than us?
Well, I think use or limiting AI is going to not just affect the professions regulated by the BSRB. It's going to affect how AI is used in things like medicine and other industries. And I think probably whoever for the state of Kansas wants to see AI regulated, it's going to cross over into other professions and practices as well. So this is just my opinion. So you could have a recommendation that would go a different direction, but it seems to me that if there's something that's broad in terms of regulating AI itself, that may need to come or at least be sponsored by probably a different a bigger group. But I'm open to other thoughts on that. I just that is a concern that I have, that maybe we would be biting off something more than we can chew if we were trying to regulate AI itself.
But would it be feasible for us to reach out to other organizations or entities or regulatory bodies that operate in Kansas and start a conversation with them so that everybody's voice was contained within something that we might propose to the legislature? For example, like the Board of Healing Arts, is that where nursing is under? No?
Nursing is its own board.
True.
Okay. So we could reach out to nurses or, physicians or PAs or OTs or, anybody that, although I don't see how an OT could be negatively impacted by AI, but that could be my ignorance. But some of these other entities that could potentially have concerns about inappropriate use of AI in working with the public or marginalized populations or persons in need.
Yeah, some of the other health boards are the Board of Nursing, like was mentioned, the Board of Healing Arts. A lot of medical professions are under that agency.
Mhm.
Board of Pharmacy, Board of Optometry,
Mhm.
perhaps the Dental Board, but some of the other boards may have a connection here.
Yeah.
I like the idea of drawing in collaborative connection. I think my concern would be, I haven't really thought this, it's kind of coming off top, but we are fairly uniquely placed that our population can talk.
Yeah.
They don't, I'm not going to go to an AI optometrist because I need somebody to put the darn machine on my face. I'm not going to go to an AI dentist, and so I don't even, off the top of my head, can't think of what other fields would need that sense of kind of protection / advocacy even to the community.
Just to play devil's advocate, I agree with you because, I retracted my OT statement, right? Like occupational therapy. But, what if they used a chatbot and they had potential patients enter information in there, and the chatbot hallucinated and suggested that they use hydrogen peroxide in their eye to flush out foreign body or something, right? When you might use hydrogen peroxide on a cut on your finger.
Yeah, I think about like you think about the nursing lines that you call up when you need, you're not getting a doctor's appointment, but you need somebody's input. We're
Yeah.
probably not far away from that being an automated phone line,
Yeah.
good, bad, or indifferent. So that's a good thought.
Yeah.
Yeah, I just feel like there should be some type of guidance. At the counseling center, students are already starting to use AI and are coming in saying that they're already using it for emotional support counseling or therapy. And so it is occurring if we like it or not, and being silent, I don't think is going to make this thing go away. And I don't think it will go away either. And so there's a part of me that thinks that maybe we define something of like, this is what we consider therapy. So maybe not defining who we are, but saying this is what we consider therapy. And if you're practicing that and it comes to the attention of the board, is there something that we could do? Looking maybe specifically at companies.
Well, and it might be worthwhile to take a look at some of this legislation that has already been presented to see how they handled this, right? I mean, if you think about the constituency of this board, it's all professions that are engaged in, this kind of approach to treating people, right? And I mean, so to allow it to run amok, really threatens the health of the public potentially. And it also kind of by, I don't know, maybe by association, kind of bleeds over into affecting the way people view our professions. And so, I think it's something that does need some kind of reins on it. How we get those is, I guess, the open question.
And this isn't the right analogy, but safety in numbers. And it could be that we're small enough that we don't have much political clout. But if more of us came together with common concerns and recommendations, that it would hold enough weight that, if nothing else, maybe it could be a governor's appointed task force on the use of AI in helping professions and what is the potential negative impact for Kansans because of that,
Yeah,
so
and
that they could come up with something.
yeah, and I think in Missouri, to be fair, the primary groups that were advocating for the legislation were the state chapter of the NASW, the Missouri Psychological Association, and so forth. It was the professional groups doing that. I'm not aware that the licensing board had any input whatsoever.
We've talked about this bill, I think, at our last meeting, but there is an interesting piece of legislation that is Senate Bill 405. It was introduced in the Senate Committee on Fed and State Affairs this year. It would have made it unlawful for a person to knowingly train artificial intelligence to encourage or support suicide or the unlawful killing of another person, provide emotional support, develop emotional relationships, act as a healthcare professional, simulate human or encourage isolation, providing civil actions for violations with potential recovery for damages, et cetera, et cetera. So that I was hoping to kind of find who had requested introduction of that bill, and it just lists the committee. But I think that is probably the most the closest bill to what we're having a conversation about today that deals with at least a piece of some of the concerns there. So Senate Bill 405, it's a pretty short bill too. I think it is only about 3 pages, so maybe worth taking a look at.
Can I just say I find the term unlawful killing to be a bit peculiar?
Would you be able to share that bill with us, or?
Sure. Yep.
Thank you.
I'd be happy to send that out, and we can add it to the materials for the meeting as well. So we'll get it posted to the website, but I'll send it to you all as well.
I agree with the sentiments that have been vocalized here about the necessity to implement some regulations of AI. I was at a conference this last weekend. It was Anxiety and Depression Association of America's conference, ADAA. Some of you may be familiar with them, and the theme of the conference had to do with the use of AI in treating depression and anxiety. And there were a number of talks where these same concerns were brought up. And I think that something that was resoundingly clear in across symposia, et cetera, from the conference is that there needs to be something that the states implement to regulate the use of AI, because the technology is outpacing regulation at a significant clip. So I would certainly be in favor of putting forward some language to put into regulation, even if it's just introductory language to monitor and regulate the use of AI in clinical spaces.
And I know the state of Kansas is interested in this as well, at least KDADS, because they put out some technology grants, and my partner at Juniper Gardens and I worked to develop a chatbot so that folks with intellectual and developmental disabilities or their families could go out and find services in the state of Kansas. And the thing that we did that the state really liked was we put up really specific guardrails so that this chatbot didn't just go out to the big wide world of possibilities, that it only went out and surveyed sites that were Kansas, ks.gov, or specific agencies that we designated as appropriate, right? And I know the state of Kansas itself is very interested in how to be able to use technology to be able to break down barriers across services that we provide in the state, while at the same time continuing to protect consumers. So it's a topic that we're not just interested in, but folks in appointed positions in the Kansas government are interested in this as well. So I think they would look to us or be appreciative of, a dialogue or some type of guidance as well. So.
Anyone else want to add anything to the discussion?
As a person who is using AI in both private practice and at the VA, I think what I would like to contribute is this technology is already in use. And I think what the board is saying is that they are trying to focus on the parts they may still have control over, and that would be conduct of professionals who are using AI. And so the initial recommendations to ensure that you're requesting permission to use AI, you're requesting permission to record, and that if somebody wants to refuse or is not, does not want to consent to that you're not able to use it. I think those all make sense. And those are all very much in line with what's happening in spaces where this is already being used. So.
Thank you, Jennifer.
Yep.
Thank you, Jennifer. And I don't want to be a negative Nelly, but I will say these suggestions are already in use by ethical individuals that are making sure they have guardrails, but that's not going to provide solid parameters within which professionals need to operate if they are using AI. I mean, there's going to be people out there that don't get consent, that don't inform, that don't use it in a way that's appropriate. And unfortunately, that's part of what it's our job to do is to police those people as well as the ones that are using it ethically.
Dave, do you need anything from us in terms of recommendations? How would you like to proceed?
Well, you took this conversation, you as a committee, in a different direction than some of the other committees. And so, one of the items that was mentioned was whether the other health agencies or our peer agencies in the state of Kansas are considering something in this area. So we do have sort of an informal meeting with heads of other agencies about once a month that we just kind of chat about different topics going on in the state. And so I'm happy to kind of float this idea and see if they're having internal conversations about this and see if they're planning to work on something or if they already have something in place. So I'm happy to collect information on that and bring it back to you. I think that could be helpful in terms of finalizing recommendations. So you could finalize recommendations today, but I'd be happy to gather that for you and bring it back, and that might be helpful. So.
I'm seeing head nods in that direction. Is there any objection to what Dave has proposed to do, which would be to have informal conversations with other agencies and then report back to us? That would probably be the June meeting. And once that information is presented to us, we could move forward if we so desire. Any objection to that?
No objection. Do you need us to make that a motion? But because I'm more than happy to make that a motion. I really feel like with the questions that have been raised today, that it's probably important to get that informal feedback before we move to approve.
Yeah, no, you don't need to make an official motion today on that. I'm just happy to talk to my colleagues and gather that information and bring it back. So I'll just plan to do that. And then after you've had a chance to review that information, if you want to make a recommendation at that time to the board, you could decide to do it by consensus or you could take a formal vote. So for today, I think I feel good about moving forward based on all the conversation today.
All right. I'll move us on to the next item under old business, and that is a continued discussion on possible changes to the postdoc year requirements. And Dave, I'll turn it back over to you to frame the discussion.
Okay. So this has been a topic that we've had on the agenda for a few meetings, but I think we wanted to bring it back to you to see if there was additional thoughts or comments. I think there was originally, I think a representative from the Kansas Psychological Association had requested to talk to the advisory committee to request some additional flexibility in terms of this postdoc year requirement. I think it was referenced some of the flexibilities that Missouri offers when it comes to that the postdoc year. And I believe that there might have been another individual who presented some information to the advisory committee several meetings ago as well, who was in favor of some increased flexibility in this area as well. So I think the advisory committee has talked about it a couple times, but I wanted to bring it back to you to see if you wanted to make any recommendations on that. I think Leslie has also looked at some ways in which that could look. So I think she has also talked to the advisory committee in the past, but if members had additional thoughts, if you thought this would be a good idea, if you had a proposal, we could talk about it as a group. Or if you had concerns or thought it would not be a good idea, we could also have that conversation as well.
Anyone with any thoughts or proposals that they would like to see be made? I know that we had left off, I think, in a number of places. One that was most salient had to do with how we would count practicum hours as part of the number of hours that could be included to to count towards licensure. And there were thoughts around whether or not it would be pre-master's hours count, or would it only be postmaster's hours? That was, I think, one significant point where we had kind of tabled things. I'm wondering if folks have any thoughts about that topic or other areas that we had discussed in our last discussion on this, which was back in December, because we did not discuss this at our last meeting. So it's been, I realized that it's been the better part of 4 months now since we last discussed this.
Yeah, it's been a while, and it keeps getting pushed back. So I'm at a blank for why there was hesitation the last time we spoke about it.
I believe, with respect, Tiffany, to the master's point, um, there were questions and discussions about the developmental stage at which trainees receive or accrue those hours pre-masters, and how that can be how the developmental stage in terms of becoming a clinician can be significantly different between the first part of someone's graduate career and the latter half of someone's graduate school career. So that is what I'm remembering, especially with respect to that point.
Okay.
And I believe that was maybe the kind of the major area where we had left off.
And I think another area of concern was, after reviewing the survey information, there were numerous concerns about the skill level of folks coming in. And I think there was some hesitancy after reading that information to.
You are correct. Yes, Jay. I am remembering that because we had gotten the survey results back, and there were a number of licensees that had vocalized concern, especially post-COVID, and especially as it relates to psychological testing, if I'm remembering correctly, that people are coming in into internship, especially without having had a similar level of training as those trainees in the past. But please tell me if I am misremembering.
I think that's a little bit of, I feel like that was more directed at master's level psychologists, was the biggest concern, that they were doing testing and those assessment reports were less than stellar. So I thought that's what I remembered.
No, thank you, Chris, for that.
I think there's been a lot of discussion around the other topics that you're bringing up, Richard, as well. Like, COVID and, preparation. There's a discussion that we had with the school that came in, and we're, hopeful that the state of Kansas, could allow them to be licensed, even though they'd not had um, a level of residents on campuses, for example, schools that are like that, and is like a few weeks occasionally at a hotel or something, where they train psychological testing, enough. So yeah, Chris, you may be right, context wise, but it seems like those issues have been talked about as well.
Any other thoughts or concerns or questions that you may have with respect to the previous discussions we've had about the postdoc year and the current discussion we're having?
Yeah, I think there was I feel like there was a point where Leslie was going to come back with like some terms defined a little bit more based on some of the write-ups that we saw. I think we got starting debating what that meant and if that counted.
Yes.
And I don't even know if that was just the this pre-masters hours count. I do remember that conversation for sure. So, but I feel like there was also some stuff that was already kind of like some edits were made and how do we think of this? And I think we paused on that.
So, with that being said, I think that this is a good place to make a suggestion that we have Leslie come. She's usually here. If Leslie would present those at the June meeting, and we can start to make some determinations about the postdoc year, then that may be helpful because I think, Chris, you're correct that we also paused on matters because there were some wording things that were going on that we wanted to have straightened out. So I'm thinking, Dave, would you have a discussion with Leslie to jog her memory if she doesn't remember this, um, uh, and we can return to this in our June meeting, and we can make it a because I Tiffany's point I think uh, is a salient one that we have had discussions about this, and I don't want to lose the thread on it because it's been going on for a little while.
Yeah, I'd be
Yeah.
happy to reach out to her. So,
Okay.
Yeah, I just found some of the notes that we printed. It was related to supervised experience and supervisor qualifications. There's a strike through on one of them. And then on this is 102-1-5A. And then number 4 was we had a highlighted remediation techniques. I guess we may be defining that. But then under C2, there's the supervisor shall provide 1 hour of individual clinical supervision for every blank hours. Like there's a question mark there. So there was just a number of things that weren't defined. And I think we paused that. But this is just the records that I have. So there might be more stuff that's happened since too. So
No, thank you for bringing that in. Any other discussion on this matter? All right, so we will return to this at the June meeting and we will proceed forward once we have the information from Leslie that Chris is referencing. I'll move us on to new business. And the first item under new business is advisory committee membership. So Dave, I'll have you tell us a bit about the discussion we had about membership.
okay. Well, as you may all recall, in the advisory committee policy, it specifies the length of service terms for advisory committee members. The policy does say that members will serve 2-year terms, and the terms basically go along with the fiscal years. So they start July 1st and run through June. And we looked at all of the members that are currently serving on the advisory committees, and we reached out across the board for all 7 advisory committees to anyone who had a term that was going to expire at the end of June 2026 and asked those individuals if they were interested in seeking to be reappointed to the advisory committee. And your committee is a little unique in that you only had 1 member who was coming upon the end of a term, and it was not their 4th term on the advisory committee, so they did have eligibility left, and they were interested in seeking to be reappointed, and that is Christopher Leonard. And so with that, you are at the maximum number of individuals on your advisory committee at 10. So just kind of wanted to relay that information. I think your advisory committee is from my perspective, I think it's going really well. I think you are having great discussions on a number of these topics. But given the language in the advisory committee policy, you are at the maximum number of members. So we won't be able to add anybody this year, but we will reach out to everyone who comes up at the end of a term next year in June of 2027. That'll be the 9 individuals that are serving on the advisory committee. And if there are openings, then we will talk to you and see if you want to continue the practice of collecting feedback from individuals wishing to serve on the committee. But this year we won't need to do that process because you're already at your max number of members. So I just wanted to relay that information to you.
Thank you, Dave. And with that being said, any questions about what Dave has said?
No questions, but I do want to say that I think this is a great group that pushes agenda items forward. And so it's nice to have some stability.
I concur, and I want to echo, just take a moment to echo what Dave said about the group that we have, and also echoing Linda. I really appreciate the work that everyone has put into this committee. I know that there can be a fair bit to read and there can be a fair bit to analyze, and I appreciate your generosity in terms of your time and your effort. And I continue to look forward to having these meetings every other month and working with all of you to do the work for the public, for the folks, the citizens of Kansas, and to regulate our profession as best as we can. So thank you all. And I'll move us on to our last agenda item, and that is a discussion on the Texas Alternative Psychology Licensing Examination. And Dave, I'll have you frame the discussion for us, please.
Okay. So you may recall we had guests from the Texas Licensing Board talk to the committee at the last meeting. Basically, a lot of this started when the ASPPB was moving forward with a plan at that time to require passage of 2 tests, the EPPP and the EPPP2. And so as one of the things that Texas did in response to that requirement, that they mobilized working with other states to oppose that, and thankfully we were able to persuade the ASPPB board not to move forward with requiring passage of the EPPP2. But separately in their state, they had expressed this is a concern, and they did not believe that their state was going to approve for them to require passage of a second test. And it was going to come down to whether ASPPB would allow them to continue to use the EPPP without requiring Part 2. And the position that ASPPB was taking at the time was, if you want to use the current test, or what they were calling it Part 1, you would have had to require Part 2 when that became a requirement. And so Texas basically said, we think our hands are being tied. There's no alternative out there. And so their legislature approved some money for the Texas Licensing Board to pursue essentially what I will call a feasibility study, to look to see could they develop their own licensing examination. And I'm probably not using the correct terminology there. When they talked to the advisory committee 2 months ago, they were very clear that this is not intended to be a Texas only exam. This is intended to be an alternative examination. And so the reason why they were talking with this advisory committee is because they are meeting with different groups that do what we do in other states to see if there is interest in states in allowing an alternative examination. Like I said, in Texas, they are not planning to get rid of the EPPP, but they would like to look at the feasibility of creating a second test, and then they would be able to give their citizens the opportunity to take the EPPP or take the second test that they are working on the feasibility of developing. If it were to actually be feasible and it would be something that they could put together, then their goal would be to make it available to other states if other states wanted to allow it as an option as well. And so they allowed some time for questions and answers at the end of their presentation. we didn't really have an opportunity for the advisory committee to talk about that at the conclusion of your meeting last time. So we did want to bring that back to you if you had thoughts after seeing the presentation between that meeting and this meeting. If you had questions you'd like me to go back and ask them about it, but did want to give you the opportunity to talk about that as a group, to see what your thoughts were.
So to clarify, this Texas group that came to talk to us last meeting are creating an alternative exam that would be a one-time exam, just in case the ASP, it's PPB or PBB,
EPB.
creates a two-part. Is that correct? So they want to have just one so that you only have to take one? Am I hearing that correctly?
They would like to have one test. And now ASPPB is also moving in the direction of having one test. But I think when there was going to be the requirement of two, that is when Texas initially started down the path of let's look to see if we can do a feasibility study. When ASPPB changed their position, the Texas legislature said, in my paraphrasing, there's no guarantee that they couldn't change their mind in the future. And so even though they changed their mind now, we still want you as a licensing board to go forward looking to see if this feasibility study makes sense. And so so they are pursuing this. They have not said that they are for sure actually developing the test, so they haven't started that process yet. But what they are doing is they have done some work internally, and then they've reached out to other people to see if there's interest in other states so that it wouldn't just be a Texas only alternative. It would truly be, if it's created, it would be an alternative for other states to use too. So
Did they say how their exam, or I guess how they're envisioning their exam would be different, or would it be similar?
From
yeah,
what, oh, sorry, Dave, go ahead, please.
go ahead, Richard. I was trying to find the presentation from the previous meetings to look at some of their slides, but go ahead if you could.
From what I remember, Tiffany, there wasn't a fully fleshed out schematic to compare to what's available with the EPPB. Like they didn't talk about differences one way or another. If I'm remembering correctly, and members, please correct me if I'm wrong, but it they didn't go into much detail about what the content would be as it was. And from what I remember, there wasn't anything that said that it would be different in X, Y, or Z ways.
From what I remember, what they said was it would be comparable in terms of measuring knowledge and skill competency or competencies, right? Which is what the EPPB or ASPPB was trying to do with part one, part two, test one, test two. But what they were trying to gauge is looking at the feasibility of going down that path, given the complexity and the expense that would go into having experts create questions, doing the inter-rater reliability to be able to develop that exam, being able to get it approved by, whatever the test taking gods are that say this test meets these standards. And then that single test that they develop would be an alternative. So states could say you either take and pass the EPPB or you take and pass the Texas exam, right? It would be one of two options. But that at this point, they're just gauging interest as the initial phase of their feasibility study. That's what I remember.
And I did find the slides. In terms of the timeline, um, they had done a survey, I believe that was in November 2025. They had some advisory groups that were meeting in Texas. That was from December 25 through February of 26. There was a technical advisory committee from January through March of 26. They were working on draft exam parameters between April and May of 2026. So that's probably where they're at right now. And then bringing those to the Texas Board and Council for approval in June of 2026. And then if they believe they have something to go forward on, potentially the plan would be to make that a legislative appropriation request in September of 2026.
To develop the exam, the legislature, the
Yeah.
appropriations bill would be to appropriate money to develop the exam.
Correct.
Yeah.
I believe that the legislature did approve some money for them to go through this process they're in right now to look at the feasibility. But then I believe they would probably be looking at, once they had put together exactly how they want the test to be developed and how the cost estimate would come together, then they would be potentially approaching their legislature in the fall, looking for a specific amount to be approved if they decide this is a good idea and it's something that they could do. Or I'm basically saying that they're the ones doing it. Most likely they would be looking to see a vendor to make sure it would hold up under psychometric standards, because there were some comments about that in their slides as well.
Mhm.
So,
So I think the question before members is one of whether or not Kansas as a jurisdiction would be um, not in favor, but amenable to joining with Texas, uh, essentially to say that it would be advisable or would be that we would approve that these money that this exam would be something that we would be interested in having be a licensing exam in the state of Kansas.
I'm willing to say no, that's a terrible idea. And my reasoning is I think about test validity. I think about, the story that's going to come across is that one is easier than the other, and that's the one to take. And my general feeling is as a field, we should be combining things across states and not splintering things further. So if somebody needs to be opposed to it, I am.
I agree with
Others,
Matt. I don't think we just don't have enough information to know exactly where this is going and what's happening. And that would be my concern is, does it create this pipeline of, like you said, one is easier than the other. Um, I don't know. It's just not enough to go on at this point.
so Dave knows how I feel about this, and I will be less animated here in a public forum about it. But I am a pretty firm no on this, and I hear the points from Tiffany and Matt. I agree with both of you. I am also concerned about how such a bifurcation of a licensing examination can take us back to when there was not one in the first place, like back in the 60s, where it was jurisdiction by jurisdiction. And it also took a while for the EPPP to take across the country. I just don't see the utility in recreating what could be a chaotic environment. And that's to the points I think of Matt and Tiffany, where it's like there could be the perception that one exam is easier than the other, and that leads to its own set of chaos. And I just don't think that is in the best interest of protecting the public. And other members, if you disagree with that, I would be more than happy to hear folks' opinions, but I'm not in favor of it.
I guess the reason I am more, I say supportive, but it's so early. I'm not really sure what I'm even supportive of. I guess conceptually, I'm more supportive because I have such concerns with the EPP's predictive value on I get we don't want to split, but I'm not sure like I care enough about protecting the and I get its deeper issues about not having a test. I understand that. But I guess I am such not a fan of the EPP. I'm not. And just today, we are discussing them raising fees. And part of me thinks, well, geez, if there was a competitor out there, that might slow their roll a little bit on that when they do not have a monopoly on it. Now, again, it's so early in this, I am conceptually supportive of the idea of another test, but until there is more there to be tangible, but I am more open to the idea. I mean, I would really like to see a test that doesn't ask future clinicians IO questions. And so I guess I'm just not worried about the EPP, though I acknowledge I do hear the concerns about splitting and a test easier than the other, and I acknowledge those concerns.
No, thank you, Jay. And your point about the predictive validity of the EPP, that has, yes, there are problems with that, and there have been problems with that for a long time. And yes, I hear you on that one for sure.
I think thinking about kind of, I'm a fan of free market and create a new, if one item doesn't work, somebody needs to come in and make the new item. I think what I'm hearing is that we want to offer an alternative test, not we want to come in and eclipse the EPPP. If that were the case, cool. Like if this was free market competition and the best test wins and we still generalize that, cool. But the one correlate that I think of is like, okay, so us in Texas create one test, and then every other state says, hey, if you took the E-quadruple-P or whatever they're going to call it, then you don't get reciprocity until you take the E-triple-P anyway. I kind of think like what keeps circling in my brain is like, what if they did this? Excuse me. What if they did this with the driver's test? Would I feel safe out on the road if there was two different kinds of ways for people tested to get a driver's license?
Mm-hmm.
My answer is no, I would not.
I'm just going to say this. I believe you can drive in different countries. I don't know if every country has the same driving test. So
Not every state has the same driving test.
Right.
So where I fall on this is I think it feels kind of early to put my finger on the scale, but I don't think we need to be in support of it. But I don't know if this needs like this is a terrible idea. I don't know if we need to get involved at this stage and just let them decide to explore it or not. The other thing is I also think if they do go competitive wise and we get to a place where this somehow eclipses the EPP because it's considered easier or it's cheaper and that's just what people are doing, EPP might disappear, and then this will get complaints as the gatekeeper too. So I think anything that becomes the single gatekeeper will be a problem. But that's just.
I'm inclined to say that we're going to have a long time to think about this because by the time they develop a test, do any kind of validity studies, especially predictive validity studies, this is going to be sometime well into the next decade before this gets ever to the point of us having to make a decision about this. So, if they want to develop something with a goal of at least being equal to the EPPP, and I would hope being better than that, I'm in support of that. But we're not going to know the answers to that for a very long time.
I agree.
Thank you. No, I appreciate that, Bob.
And I'm not sure they were asking us to throw our hat in the ring with them. Did you hear him say that, Richard?
Say that one more time. No, you cut out a bit.
Oh, I'm sorry. I don't think that they were asking us to throw our hat in the ring with them. I think they were just asking, would there be an would there be an interest in seeing how this played out?
Right. They did not ask for whether or not we would go in with them in the studies. No, that is true.
Yeah, I think there might have been sort of an invitation if we had people who were interested in serving on some of their committees, looking at the
Mm.
feasibility. Because I was looking back at some of the slides, the one that they were talking about gathering stakeholder input said an open survey, broad questions of psychology community, presentations to fellow boards, and then an open invitation to participate. And then the advisory work groups, assessment goals, format and administration, regulation and approval. So I think they were kind of giving us their path as they're walking forward, gauging at least possible interest, knowing that they haven't taken the step to say we're definitely going to go forward with this. But since they have some groups that were being set up, I think they were interested in, if somebody was really interested, perhaps they could have served on one of their committees
Right.
for feasibility. But I think that's all they were looking at right now. So
Any other thoughts or comments or concerns or questions about this matter? I don't think that we need a vote on anything. I think this was more of a just Dave, am I putting this together correctly?
yeah, I just wanted to give the advisory committee an opportunity, since you had received the presentation from them, had Q&A at that meeting. I wanted to let you think about it a little bit more between that one and this one, and then discuss it amongst yourself. But we don't need an official recommendation. I will just keep you informed. I'll hopefully see a contact from Texas at the ASPPB mid-year meeting, and then we can kind of talk and say, how is that going, and what are you looking at right now? And we'll just keep you informed as they go forward.
All right. With that being said, it is 7:45 and we have reached the end of our agenda. Um, what was that? I didn't hear you,
I
Linda.
just laughed. Good job, Richard.
Oh, no. I take no credit in this. Anything anyone would want to add, any questions about what we've discussed? Our next meeting would be Tuesday, the 9th of June, 2026 at 6 p.m. Seeing none, I'll take a motion to adjourn.
So moved.
Linda moves, and
Second.
I did not see who seconded, but there is a second. And it was David Stevens. And you know what? I think that we all would vote to adjourn our meeting 14 minutes early. So thank you all for coming this evening. Good to see all of you. I look forward to seeing you in a couple of months.
Thank you.
Sounds good. Bye.